Ready to light that fire by doing the things that make you come alive? Welcome to Health Raisers, a podcast for wise women. I'm your host, Dr. Nadine. I left a soul-crushing medical career full of bad news and evolved into a joyful health integration coach, helping hundreds of women find their healthy. You're more than your dress size. Stop putting up with toxic relationships, swallowing your true emotions, and sacrificing your mental health. Stop using your body as a battlefield. You're always giving. You deserve to put yourself first, not just for your sake, but for those you love. Wise women, let's make ourselves a priority right now. It's time to raise some health together. Hello, wise women. Today, I am very excited to welcome our guest, Nicole Fleischmann, MD. She is in Urogynecology. She is an incredible guest because this is a person who is like-minded. I just love people like this who are so willing to pursue ways that are meaningful to really help a patient, to really help an individual live a better day-to-day life, despite naysayers. So what Dr. Nicole specializes in is urogynecology, as I mentioned. She has had 25 years of experience in this field and believes that practicing an integrative approach to urogynecology, correcting unconscious and paradoxical behaviors that can cause structural problems for women is very important. It drove her to write this book, The Second Mouth, which is the book that I devoured. It talks about overall addressing the powerful mind-body connection and helping us women understand our bodies better. High time we have someone like this. So I'm going to read one of the quotes in the book that I really, really love, and then we can get started with our deep discussion. Life requires us to oversee and take responsibility for our behaviors unless we choose to stay asleep. Preach. Preach, Dr. Nicole. Thank you for being here.
Thank you so much, Nadine. We're becoming fast friends. I see that.
I'm just blown away. I mean, I stayed up really late just reading and I was not bored. I was really, it's just, the book is written in a very approachable way. You have a lot of empathy in the book. You are really trying to help us with firm examples and also true life stories of patients you've treated to help us to understand how most of us women do not know how our pelvic floors work. And it causes problems for many of us.
You hit it in a nutshell.
As you well know. Mm-hmm.
You hit it in a nutshell.
Mm-hmm.
Yes. And most importantly, it's not our fault that we don't understand. That's the main thing I want to say. None of it is our fault. It's a blind spot that we, as a collective, have not overcome. This is really not about individuals at all. This is a collective problem. And because it's collective, we have 100% of people disconnected. 100%. So if the entire collective world is disconnected, it is not easy to undo this. But we can. We can. I believe that we can. I just think we have to have some clear voices, some clear language to help us understand what disconnection actually means. Because when you're disconnected, you don't know you're disconnected. That's what disconnected means. You have no idea you're disconnected. You might think you're connected, but you're not. So we need to really understand what connected means so that we can know when we're not.
So As we begin the conversation, we are going to really focus on the pelvic floor. So I want to get us started by asking you to explain to us what it is. What is the pelvic floor?
I think it's more important for us to understand what the pelvic floor does than what it is. I think we need to know where it is and what it does. Okay. I think other than that, we don't need to know much else. Where is your pelvic floor? It's a giant sheet of muscles on the back wall of your vagina. Okay? Simple. So your vagina has a front wall, which is the wall that your bladder sits behind, and a back wall where your rectum sits behind. At the very top is the uterus, or if you don't have a uterus, we call it a cuff, if it's been surgically removed. So the pelvic floor is a sheet of muscles between your vagina and your rectum. So if you actually put your finger in your vagina, and I don't mean to be crude, but this is how you find out where it is. We're going to have
this discussion. We got to have this talk.
I think we need to know where it is so that we know what I'm talking about. And it's basically, if you put your finger on the back side of your vagina and press down, you're touching your pelvic floor. So that's where it is. What does it do? It functions like the jaw of a mouth. It's very simple. So just like your jaw can lower and raise to open and close your mouth, the pelvic floor opens and closes like a jaw. That's what it does. Those two things, where it is and what it does, is what you need to know.
It's a really powerful visual. It just makes so much sense to think of it that way. And as you phrase it that way, it also really brings home the idea that it is something that we can control. So we take for granted, or we think of the mouth. We know that we can open and close our mouths, right? But we don't tend to think that we have any power or control over. It's almost like we think the movement of the pelvic floor is involuntary, kind of like our internal organs.
It is involuntary. That's the problem, but it shouldn't be. It's involuntary until we take it over.
Okay.
So that's the point. We all have involuntary pelvic floors until we make a conscious connection to it. And that's what the book is trying to teach people how to do. And you don't do that without the correct model. If you don't have a model of what the other side looks like, you don't really understand. So the model of the mouth is the right model because it opens and closes, and you're born with it closed.
Why is it important that we make this connection?
Because you need to open the mouth of the vagina for certain things. And I'm going to tell you what those things are. Urination, peeing, defecation, pooping, having a child, pushing a baby out, which you shouldn't be pushing. You'll understand more when we get into the conversation. But opening is how we release anything from our body, anything at all, even blood from a menstrual cycle. We have to open to release or be partially open at times. And it's also to let something in, we have to open. Think about your own mouth. Think about the top mouth. It's such a good model. So if you were vomiting, you would need to open your mouth to let the vomit out, right? You would just know how to do that. And when you want to eat, you have to open your mouth. So if you try to do all those things through a closed mouth, that's what not having pelvic floor control means. And you start to damage yourself by doing functions through a closed mouth. And I hate to say it because it really sounds, it's almost like, what is she talking about? You don't know what I'm talking about because you're disconnected. I don't know how to say it. If you were connected, you would know what I mean. And I hope that everybody listening can learn to connect.
And now, here's an ad from our sponsor. In the mood for coffee, tea, yummy pastries, or cool swag? My friends at Infusco have got you covered. Infusco Coffee Roasters is a cozy neighborhood coffee joint in Sawyer and St. Joseph, Michigan. Infusco stands for a healthy community. They craft irresistible seasonal drinks, sourcing local artisans' products. The flavors shine from quality ingredients, and their beans are roasted on site. They do not hide behind tons of sugar. Every time I go, I'm greeted by my name with a smile. Bad service is just non-existent. It feels like stepping into a friend's living room. They keep it personal. Old school, eclectic coffee mugs on the wall, fun merch, including stickers designed by artists, t-shirts, and sweatshirts. It's the perfect place to get to know your neighbors and chat with tourists. You will always find people deep in conversation. Special events keep it fresh. Community, health, the heart of Sawyer. That's in Fusco. I hope to meet you there. Well, I will say part of what really connected with me in the book as well is not just the visualization of a second mouth, but also how breathing is so integral to, and it just made so much sense. The way you talked about the vacuum and how there's an inlet and an outlet, it just really helped solidify the concept of the bringing the air in when we do the sniffing, which I'm sure we'll get to talk about, but softening, bringing air down into the lower extremities, and into the pelvic area so that we can gain more blood flow as well as opening. So it's not just opening, but it's also not suffering because we're choking off the blood flow to our pelvic floor. It's
an eye-opening understanding of what's going on in your own body. And your lack of understanding up until this point is not your fault. Think about it, Nadine. You are somebody who's been studying medicine for many years, and you also are a yoga teacher. I mean, of all people that I know, you are a person who should understand this, maybe even before you heard this, but you did not. You understood it, a lot of it, you understand. That's why you've understood so much of it that you making the connection is quite easy because it fits into your world. But everything you've learned has not fit into your world. Mm. And so that's why you were a little bit confused because everything you heard was against that.
Well, and here's the thing, going to the gynecologist, the last time I went, when she did my pelvic exam, she talked about Kegels again.
We can get into Kegels. We can get into what they mean. We can get into how we got off track, where we screwed up. Mm-hmm. Let's talk about where we screwed up. Mm-hmm. It was our lack of understanding of how the pelvic floor works is what brought us into the world of Kegels. And it started with a man. I mean, it started with a man who wrote some papers about it.
What a shock.
And again, remember, we can't be angry with this guy because, I mean, I'm terribly angry. I won't lie. I always, I just feel that like, in my body when I think about, whenever somebody says Kegels to me and I always ask people, are you doing them? They say, yes. I say, you need to stop. I mean, I berate them over this, but it's not his fault. He just had the wrong idea, but we all believed it and spread it widely. And our entire system of urogynecology is based on this understanding that women are weak and need to learn to tighten. Mm-hmm. And it's not true. It's the opposite. We are too tight and we need to learn to open. Mm-hmm. And the reason that somebody might say, oh, you have weak muscles is because you are damaging your bottom by pushing through tight muscles. So it looks like you're weak because you've created weakness, but that's just a hernia. You just create a hernia by not opening your bottom. And we can talk about the mechanics, but we don't really need to. We could just talk about how you're not supposed to squeeze. You don't need to squeeze anything. And you're not supposed to walk around holding in all day. And that's a very cultural thing of abdominal sucking and vagina clenching and butt clenching. We don't even know we're doing it. We've been doing it since we were 2 years old when we learned to toilet train.
Okay. So you mentioned the clenching and the holding. This is something that was a little that I wondered about as I was reading. As a yoga teacher, I want to make sure that it's important to learn. I consider myself a curious person and a humble person. I don't know everything and things change. And when you get new information that makes sense, it's important to process that information, try it and see if it works.
Thank you. I love that.
So my question to you is, I teach mountain pose a lot. I know you take yoga classes as well.
I know, but I don't know a lot about yoga. I just started taking hot yoga, Bikram. So I don't know all of those things. I know that very specific type of yoga, and I don't know what mountain pose is, but you could describe it to me.
So I'm going to describe mountain pose, and then I want you to let me know what cues might need a little bit of massaging to help the entire body and to consider the pelvic floor. So mountain pose is just as it sounds. It's standing or sitting tall with good posture. It's stacking your joints. So your shoulders are lined up over your hips. Your hips are stacked over your knees. Your knees are stacked over your ankles.
Perfect.
Your feet point forward. You don't put stress on your joints. So you don't have locked knees. You soften them a touch. You keep your pelvis in a neutral position. It's not tilted forward. It's not tilted back. And we also have to make sure that our heads are in the center of the bowl of the pelvis. Well, another cue would be to, if you bisect the ear, that line intersects or bisects the shoulder. And also the back of your head lines up with your sacrum, the back of your pelvis. So when we're talking about muscle engagement in order to hold mountain pose, using your glutes, using your buttock muscles in order to attain some stability, drawing your navel in, not holding it in the whole time. We do allow for breathing, but is there anything wrong with maintaining that posture? Are we not giving the pelvic floor the care that it needs if we hold mountain? Because you mentioned people in your book that were too rigid.
Okay, I think I want to just try to answer this, and I need to understand more. Mountain pose is an exercise? It's an exercise you do?
It's the foundational pose for everything.
Is it? So is mountain pose the way you're supposed to stand in life?
Yeah.
Is it?
Yeah.
That's what you would say?
That's what I teach, yeah.
Okay. Who taught you mountain pose?
My yoga teachers, my seasoned yoga teachers when I was learning several years ago.
Okay. And who taught it to them?
Their teachers, their predecessors.
And who taught it to them? How many generations passed until you got the information? Where did it originally come from?
Thousands of years ago. Yes.
Okay. So I see this happening, and I don't want to comment on any of these ancient ancient wisdoms. And I believe me, I think that most of them are very correct. And I'm a marvel of yoga. I love it. But I do think that there are some things that have been lost in translation. I really believe that. And I think this mountain pose that you described just might be a little lost in translation because we did forget about the pelvic floor, like you said. And maybe that's just because we're disconnected. And this embodied knowledge is not easy to transfer. Not at all. If it was, we wouldn't be in this state. Okay. The transferring of embodied knowledge, is what yoga is trying to do, is very difficult because we're trying to use words to describe feelings and movements, very subtle postural movements in the body. And you have to describe them with words. And that is just the challenge of the yoga teacher, right? But you can imagine that something like the pelvic floor could get lost in that. So your mountain pose, I love, because I teach that too. I didn't know it was called mountain pose, but I teach posturing to all of my patients, and everything you described, I do teach them. But for one thing, it sounds different. I teach them to let their belly go.
So we talk
I
about
teach
that
them
with
to
the
let
breathing.
their belly go. Exactly. Yeah. I don't want anybody sucking in their abdomen ever. First of all, if you look at this from an evolutionary perspective, we're supposed to be in a 4-degree tilt forward. 4-degree tilt. That's all it takes for us to be actually perfectly postured. So when you say in alignment, we're actually supposed to be 4 degrees, which is nothing. It's nothing 4 degrees, but we're supposed to be in a slightly lean forward posture. And this is what some of those Olympic runners learn. The ones who learn that sort of lean forward with their run, they're going faster. Okay. So when you're in just a 4-degree lean forward, letting your abdomen go is very easy. You just have to learn to disengage it and to stop clamping your glutes. Because it's not until then that you can breathe. You're not supposed to be holding your breath and chest breathing when you walk around. That is not what you're supposed to do.
And that is not what I teach.
But if you're sucking in your abdomen, if you're sucking it in, you cannot breathe with your diaphragm.
So at the end of the exhale?
So you shouldn't suck in anything because you cannot expand your abdomen. You cannot allow your diaphragm to work if you're pulling your abdomen in. This is why I don't like abdominal sucking. We are the only animals on the planet that do it. We are the only ones. No other animal sucks in their guts. I don't think we were meant to stand with sucked in guts and clamped glutes. We were meant to have very relaxed muscles. And listen, by the way, letting your abdomen out doesn't mean that you can't engage your core. There is a way to engage your core without sucking in. And that's also a very subtle difference between sucking your gut in and engaging your core muscles. You can engage them without doing that, but it's very hard to teach that. So here, this is why I think maybe your mountain pose is fine, but try to do it next time, without sucking anything in, with just letting your muscles relax and learning to breathe with a sniff. And you will see your bottom will get air. Because here's the thing, when you're clamping your muscles around your bladder and your colon all the time, they don't work. They don't work. You're sending a silence message to them. And if you send a silence message, especially to your colon all day long and to your bladder too, it just doesn't do its job.
So let's focus in on that a little bit more, because I think the idea tends to be, I have a UTI, a urinary tract infection. Oh, that's because I have a bacterial infection, and if I take an antibiotic, then I'm fine. There's hardly ever let's take a step back from that. Why did you have the bacterial infection to begin with? And I think this is what you're starting to get into, because you describe pelvic dysfunction in many ways occurring because we're not doing the preventive work. We're
not opening our bottoms on the toilet to urinate. And when we don't do that, we are creating a situation where bacteria is going to grow. When we open our bottoms, which is open your bottom is really dropping your puborectalis muscle into the downward position, which only happens with a sniff, by the way. It only happens that way. So that's why breathing and toileting go together. They're one and the same. You can't
see the way we think about it, though, is in the reverse. Squeeze it out. Squeeze.
That's what we see on urodynamics. We see a lot of squeezing behaviors, but they are called dysfunctional voiding. That's what we call them in urology. So if you're a dysfunctional voider, dysfunctional urinator, meaning you're clamping while your bladder's trying to empty, you are going to likely get a UTI. And if you don't get it when you're young, you're going to get it when you're old. Because it's not how you're supposed to pee. You can pee like that. And by the way, it does work, because there's another system that allows us to urinate like that. But it's a dysfunctional system. It's dysfunctional. When you push, your bladder will contract. But that's how people with spinal cord injuries pee. We all pee like we have a spinal cord injury. If we want to get our forebrains involved with the process, it has to start with a sniff. Otherwise, we are not engaging our external sphincter to open. We're just pushing through it. And when we do that, we don't get that beautiful toilet flush of a void. When you open your bottom, your bladder literally goes it's like flushing a toilet. It circulates the urine. It's called laminar flow. It cleans your urethra. If you push, you're not getting laminar flow. So you're not using the mechanisms that are already built inside of us to protect us from UTIs. You're not using them.
So it's like mouth breathing, which is not as efficient, because that's not what it's for, unless you don't have a choice, versus breathing through your nose.
Why does someone not have a choice? Wait. I want to back up. Why does someone not have a choice about mouth breathing?
Well, if you have a really terrible cold, because I've been in that position before, where it's temporary.
Okay, yeah, temporary.
That's what I mean by that. Temporary.
There are times when your nose is so stuffed up. I've been there where you can, but I don't. There are people who say that they cannot do it for certain reasons, and I tell them I can't think of a single reason, because even if you have a deviated septum or you have clogged sinus, you can do it. It's just a little harder, but you have to learn, because it is a lifeline. And you don't want to cut your lifeline off. You have to learn, and you have to focus, and you have to make that part of your life. That's part of growing up.
How did you come up with calling it a second mouth? It's just so effective, I think.
I think so too, because it's right. See, when something's right, you don't have to think about, how did she think of this? You don't have to think about it. It's just what it is. And I think the fact that we haven't known that it's so sad. It's so sad. But I don't want to look at it as a sadness anymore, because I do that every day. I look at it as an opportunity for us to all change, and we can change. This is something we can teach each other. We were all meant to learn this, but we all need a teacher and we don't have one.
So let me ask you this. What about a person who is seasoned, a woman who's seasoned? I'm sure you've seen this plenty of times. Seasoned? She is an elder. She's an older. She's mature.
I see. So that's a very kind way to say older person. She's seasoned. Okay.
So she's saying some stuff, and now you're telling her you don't know how to toilet properly. What would you say to someone who feels like, well, what do you mean? It seems to be working. Why would you tell me I need to do this differently?
So now you're reaching the resistance I entertain on a daily basis, and it's not easy. It's not easy, but I use certain cues and words to turn them around. I say, well, you're here for a reason. So something's not working. Something's not right. And people, when you say that to people, they think, well, there's something wrong with my body. And you need to find it, doctor. And then you need to fix the thing that's wrong with my body. That's a very common perception in Western medicine. And I just get them off that track. I'm like, there's nothing wrong with you. You just didn't learn something, and you can learn it at any age. So I see a lot of older women. I see women in their 80s, 90s. I have taught this to women of all ages, and I have been shocked at how some of the older women have gotten it. Because here's the thing. This is something we were all meant to learn. This nerve pathway is something that we all were meant to learn, and it lives in us. It's just dormant until we activate it. It's like you have to activate this system in yourself to understand what I mean. But you can do it at any age, and it works at any age. But yes, you're right. If you've had bad habits for 80 years, it's much harder to undo bad habits, but it's not impossible. And I have a lot of women who are 80 and they look amazing, and they're taking care of themselves, and they're going to the gym, and they're doing yoga, and they're trying desperately to live with quality of life. So they are ready to hear this stuff, and they really appreciate the information. It's not always a resistance.
Okay. So here's another question that I wondered about, because we talked about not sucking and holding things in. What about the industry of shapewear?
Okay. I want you to know, I went on a retreat this weekend. I told you I was driving up to Vermont. I was going on a spiritual retreat because I've never done something like that. I had a friend who said, you got to do this. Because, I deal with a lot. I'm a urologist, but I feel like I'm a shaman most times. I really do. And I'm taking in everybody's darkness, and I'm trying to deal with it. And I'm trying to not let it snap at me all the time, because it often does. So I have a good friend, and she says, come on this retreat. And I was with 9 other women, and they were all Dominican. It was hilarious because the woman who runs the retreat, who's a wonderful woman, is also Dominican. And she actually, her name is Maria Trusa, and she runs an organization for women who have survived sexual abuse. And it runs rampant in this culture. So Dominican women are very big on this. It's called a faja, I think, if I say it correctly. Probably they'd be laughing at me if they heard me say it, because I don't really know how to pronounce it. But it's basically this tight, like girdle type thing that makes you suck everything in. And I tell them, please don't use that thing. It's so bad for you. Look, think about it this way. Do you know what the core is? You know what the core, of course, the core of your body. That's where all your organs are. It's the area between your bra strap in the front and your sort of the middle of your back behind you. And then it goes all the way to your pubic bone in front and to your coccyx in the back. It's a big space, and it's where all your organs sit. Okay. That space needs some room to work. Okay. It just needs room, because if it doesn't have room, the organs in it just don't function as well. Okay. You can't let the blood flow get in there. Sucking in the stomach is basically like living in a house with the walls caving in. And I don't know why anybody would ever think that that's a good thing to do. But if you want if you want your colon to bring stool down, if you want your kidneys to bring urine down, if you want your blood to pump through your body all the way through and reach and go back to your heart, you cannot compress your abdomen like that. These compressions that we give to our abdomen, whether it's with a garment like that thing, the faja, or just that you're sucking in so tightly, and don't even know you're doing it. That's how conditioned it is. So I need to tell you, stop sucking in. Your organs can't function. They don't function the same way. Fill your abdomen with air. Feed oxygen to your organs. You need to supply it because they're not going to get it if you don't give it. They're not going to get it.
So it's parasympathetic activation too.
Yes,
It's versus
that's exactly what it is.
Versus living in fight or flight. I didn't think of it this way. And it was something you said in the book where it's all that sucking in and compression and tightening is what we do when we're in fight or flight mode.
Exactly.
Not parasympathetic.
Chest breathing is stimulating your sympathetic nervous system. If you want to have a panic attack, keep chest breathing. And chest breathing can be through your nose. That's why I hate to always say mouth breathing, because there's many people that try to nose breathe into their chests. And it's just as dysfunctional as mouth breathing in many ways. So I really just need people to understand that there is only one way to breathe. There's only one way we were meant to breathe. And we are fighting it every step of the way by sucking in our guts.
Let's transition now to what can result from what you see on a regular basis with your patients. Some things like, and I'm sure the audience can totally relate to this. We've all experienced this at one time or another, especially after vaginal births. Incontinence, difficulty urinating, UTIs, prolapse, menopause, and what happens after menopause. And so kind of talk about these different issues and what you see.
You have 5 hours in this podcast. I think we should tackle one because truthfully, I can get into each one of these things, and I encourage anybody really to get the book or we'll continue these discussions, but let's talk about incontinence, okay? Because that's a big one for people.
That's a common one, yes.
That's a common one, especially after childbirth. And people try to figure out, why am I leaking? Why is it happening? And it's always from the same reason. We have to understand leakage happens from the same reason. It's not being connected to the other side of our body. And sometimes we get structural problems related to that. But when you learn how to pee correctly, when you learn how to release urine from your body in a coordinated way, which always is coordinating with your breath, you don't damage your bottom. And when you push out your pee, and people, listen, I hate to, because a lot of people say, I don't push out my pee. No, I just relax and it comes right out. I want people to understand that concept of relaxing in most cases is actually pushing. Our brains do not understand the difference. If you shift your posture just a little bit, you curve your back just a little bit to start your stream, you have to watch yourself what you're doing because you don't know what you do. Nobody's paying attention to what they do on the toilet, but you're supposed to be paying attention. It's part of your job. It's part of your job to make sure that you are releasing urine from your body in a healthful way. Okay? So when you sit on the toilet and you relax, most of the time you're just holding your breath and bearing down. And it really feels like relaxing. And that's what little kids do. When we're toilet training and we have to figure out how to get urine out of our body, that's what we do. Okay? Some of us do process that as pushing, but a lot of us do not. It's always pushing. And it's how we start our streams. That's what causes leakage. Because when you push through a closed door, when you're not opening the sphincter muscle, if you're just pushing through it, you're going to damage the closure mechanism. It's not going to close properly. It's like if you have a locked door and you're constantly ramming your body to get through it, it's just not going to close. All right. So that when you are walking around, you're going to leak. Or if you cough, you're going to leak. You know, that's a damaged closure mechanism. So the first thing you need to do if you have incontinence is you have to figure out how to stop pushing through a closed door. And the way to do that is to take a sniff. And I always tell people when they learn to sniff, you think you know how to sniff? That's another thing I had to learn to teach people. This was like a crazy thing. What do you mean they don't know how to sniff? Why don't people know how to sniff? They don't. Okay. I don't know how this happened to us. We're all disembodied. But sniffing means that you're pulling air through your nose. And it sounds a little bit like you're sucking in snot. I always tell people, as gross as it sounds, that's a sniff. And it doesn't involve your chest. It doesn't involve your neck. It doesn't involve any part of your body, just your nose. When you do that, you're pulling air into your lungs. You're engaging your diaphragm, and we call it a mini breath. Okay. It's how you start your breath. Now, in order to release urine, you have to start with a sniff, but you also have to release your abdomen and your glutes. So you do it at the same time. You're pushing your belly out, you're releasing your glutes, and you're bringing the air to the bottom. And that's how you pee, with airflow. You're pushing with airflow. And this is how you keep your closure mechanism intact. This is how you don't damage it.
So can you reverse? Is it ever too late?
Okay. I want to tell you what I know about the human body. It's amazing. It's amazing. Our body has tremendous healing powers. But in order for any part of our body to heal, it needs blood flow. You cannot, and this is why I have a problem with Kegels in general, because they have all these women going on these like resistance exercises right after they delivered a baby. I'm like, wait a second. They need to have blood flow go down there. If you're constantly clamping, you are cutting off the circulation. Do not do that. Do not cut off the circulation. Okay. If you bring blood flow to the bottom of your body, which only happens with a sniff, you just have to understand the sniff is what brings blood flow to the other side of your body. And it's a call to your organs, but you can't clamp against your sniff. And in order to know if you're doing that, you have to pay attention. You have to actually take a quick sniff. And at first you'll see your guarding reflex is going to snap back at it, but you have to be mindful enough to not let that happen. And then you can open your bottom. And when you do that, you're getting blood flow to that area. And I'm telling you, you can heal. And I encourage everybody to do that before they have surgery of any kind in that area. But sometimes the structural damage is so bad that it does need to be fixed. If your bladder is hanging out of you like a grapefruit,
prolapse.
Yeah, we got to put that in. I mean, I can't, you're not going to snip your way to losing your grapefruit. I got to get rid of the grapefruit. Seriously. I mean, there's a point of no return. And I don't want people to get to that point. I want people to understand this stuff before they've pushed their organs out. It's very important.
Okay.
And people get mad at me, by the way, when I say that, because it makes it sound like people are doing it to themselves. It's all your fault. You did this. That is not what I'm trying to say. I want people to understand this is a disconnection. We do not know we are doing this. It's not our fault.
Well, it's sort of like it took a long time for, and you know this, for the practice of washing hands to go into an operating room to take. People thought he was crazy for a long time and resisted washing. And we take that for granted now, but that's something that was someone thought about, tested, found that it worked, and then had to convince everyone around him, hey, we should adopt this to save lives. We're killing too many women in childbirth with our dirty hands.
Exactly. I know that story and I relate to that person very much. And it's not an easy position to be in because I know what I'm saying is right. To the point where I'm not going to shut up about it until I'm dead. I'll go on every podcast. I have no problem. There's nothing I won't say because I know this is a global health problem. And by the way, it affects men too. But women have more problems related to it because we deliver children. So we really damage ourselves in that process by not understanding these mechanisms.
Okay, what about for us? And look, I'm just going to say it, okay?
Go ahead. Let's get it all out there. Get it all out there, girl.
I'm a germaphobe. So I do not sit on public toilets.
Okay. Let's talk about that. Let's talk about the data. See, when you have a phobia, and that's what germophobia is, you need to look at data because you're an educated, intelligent person. So data will make sense to you. You are much more likely to get a UTI from hovering over a toilet than from sitting on it. So whatever you think cooties are there, whatever cooties you think are going on there, they are exactly that, cooties. And I remember cooties from kindergarten, first grade, is these imaginary bugs that you could get. Someone they could just jump on you. God knows what they do when they get on you. But that's the thing about toilets. This is really a cootie problem. And listen, I get it. There are toilets I would not sit on if you paid me money. I remember one time my husband and I pulled over to this gas station. I really had to pee. And I walk in there and not only is there no toilet seat.
Yeah.
Yeah. But I really had to pee. I was like, I'm sitting here. I get that. But in your daily practice, you have to find a way to sit. because every time you hover over a toilet, you're risking damaging yourself. And you just have to think about it this way. Power peeing, pushing to pee is bad for you. I can tell you that without any reservation, but I don't think I feel that way about sitting on a toilet. So I tell my patients, get some Clorox wipes, carry them in your bag. You can disinfect that seat, sit and assume toilet posture. There's a toilet posture that I teach. Assume it because it's healthy for your body and you love yourself. That's why you do that.
So talk about the toilet posture.
It's hard to describe audio. I have to show it to you, but it's very close to, if you ever saw the position of the thinker, that statue, the thinker, it's a lean forward position. But just like, and you probably have positions like this in yoga. I should ask you, is there a position like this in yoga? It's a straight back. Your thighs are parallel to the floor and your feet are planted on the floor. There are no stools unless your feet do not hit the floor.
It's almost like chair pose.
It's probably like chair pose. I don't like the squatty potty. I don't want anybody's thighs above their hips. That's not good.
And the idea of the squatty potty was to relax those muscles. So why is it counterintuitive or not correct?
Because your thighs cannot be above your hips. Because if they are, you're planting yourself on your tailbone and you can't open your second mouth.
Okay.
The second mouth is the jaw of the mouth. If you try to open
then you can't open it. Yeah.
Now, what the squatty potty did get right was the angle, but you can make that angle by keeping your back straight, leaning forward, and putting your elbows on your knees. But here's the key. This is what everybody needs to know about that posture. You have to release your abdomen. You cannot suck in your abdomen and pee or poop correctly because that's stimulating the wrong side of the nervous system.
And
you're not releasing your pelvic floor.
Hovering over the toilet seat is
pee pushing. It's pee pushing. If you don't know that's what it is, just watch yourself the next time you do it. You are starting by pushing. And even if your bladder has to go really badly, you're still using force to get things out of you. And that's how people develop leakage problems over time. When you really think about the physiology, you understand why I say this.
Okay. Let's shift to menopause.
The great awakener, menopause.
For instance, a person like me, I can't do hormone therapy because I have a family history of high-grade breast cancer in two young, mother and sister. So estrogen has so many beneficial effects for taking care of, our gynecologic tract. So, and urological, and so many other things, bones, our hearts. So for a person like me who cannot benefit from hormone replacement therapy, what are things I can do to care for my pelvic floor?
So you don't need hormone replacement therapy to care for your pelvic floor, but it does help. It does help because when we lose estrogen, we're losing a lot of things in our bottoms. Okay. I mean, we have estrogen receptors all throughout our body and in our brains as well. In the pelvic floor, they bring blood flow. Estrogen brings blood flow to our pelvic floor, to our bladders. It makes everything healthier and work better. But I look at estrogen as when we have our estrogen, that's our time to really learn how we're supposed to be. Because if by the time you lose estrogen, if you haven't figured this stuff out, we start to get symptoms of pelvic floor dysfunction. So if you haven't conquered the pelvic floor dysfunction, if you haven't made a brain connection, by the time you hit menopause, you're likely to become symptomatic because you don't have the reserve anymore. You don't have the safety net of estrogen protecting you from the feelings that you have below by clamping your bottom 24/7.
So then it becomes more important then. to practice
yes,
proper
menopause is
toileting.
a great awakening because you start to get symptoms of butt and vagina clenching. You really know what it means. It's a burning sensation. And that is a call to your mind. That's a call to you to say, hey, pay attention down here. Any symptom, I tell my patients, any symptom is a call to you. Something is wrong. And I need you to pay attention here. And in the case of menopause, you've got to start paying attention to the muscles of your bottom and making sure you are not walking around clamping them all day. And here's the thing, we're all doing it. Every single person I know is butt clenching and vagina clenching all day long. We learned this since childhood. So your ability to know that you're doing it and to take it down when you're, especially after menopause, is going to save you from a lot of the things that could be helped by some hormone replacement therapy, but you could do it without it. You just have to be a little bit more mindful. You have to be more in charge of your breath, making sure that every muscle of your pelvic floor is receiving air throughout the day. And that requires you to learn diaphragmatic breathing, which is how our body is designed to breathe. You just have to grow up and do what you're supposed to. And then you get to have comfort in your later years, even if you're not on hormone replacement therapy.
Is there anything else you can think of that we might have left out in this? I'm sure we could keep going, and I can ask you a ton more questions.
Well, ask me listen, you can ask me anything you want because I love to talk about this stuff because I really understand it. And I don't understand all of it, but I know I'm on the right track. I learn new things every day. My patients teach me new things every day, and I've learned with my own body. If you think that I haven't had all these things, how do you think I know this? I know this because I've had it, and I still have it. Pelvic floor dysfunction is a lack of control of our guarding reflex. Our guarding reflex is an infantile reflex that we are born with that clamps us closed and gets activated during times of stress. So when you are stressed, you are more likely to have your guarding reflex activated. It's especially chronic stress. It often manifests in the muscles of the pelvic floor. So I always say I'm much more of a psychiatrist than a urologist because I can tell how you're feeling just by examining you. People who are holding their pelvic floor very tightly are usually doing that when they're anxious or stressed. And anxiety is something that
fascinating.
I thought I would just give you the stress piece of it because it's really important for you to understand that with age comes stress. And if you haven't learned to regulate your parasympathetic nervous system, if you haven't learned to bring that into your life actively throughout the day, stress takes you over in age and you don't even know it's happening.
Not to give away the entire book, but
please give it away. Give it away 5. I want to scream it from the hilltops. I just want people to understand this stuff.
Okay, so there were a couple of stories in your book of your own difficulties during a stressful moment when you had a sister-in-law who was leaving us, someone you were very close to. And you had another patient who was also, I think a few patients who were, you would ask them about, how are you doing? You know, what's going on with you? And it's like, oh, you know, my sister's got pancreatic cancer and you know, this kind of thing. And then the connection with examining the pelvic floor showed a lack of blood flow to those regions, a lot of clenching, developing the UTIs. You know, if I were to go, and I am going to, but it'll be interesting to see what people say when I say, well, you know, stress really can cause you to have incontinence. They're going to be like, what are you talking about?
It is 100% true, Nadine. And I tell everybody that most people who come to see me as a patient, I grill them on what's going on in their life. And we almost 100% of the time can find the moment where their problem started. And it usually started with something simple as I moved, or I started a new job, or I had a woman today tell me that her son lost his job and moved back in it with her. And that's when her frequency started. You have to understand that our bladder is a psychological organ. It responds to stress. And so does our colon. If you look at the brain-gut axis, it's all about how our thought patterns control our gut. This is proven. Okay. And you can feel it in your body. We all know that when we are anxious, we feel butterflies in our stomach, or you can feel these sensations in your body when you're stressed. Those sensations are an activation sometimes of your sympathetic nervous system, right? So I always tell people that stress is going to affect your organs, and it really affects your pelvic floor because you will unconsciously be clamping. So you have to pay attention to clamping behaviors. You should not allow them. You should know they're happening and you need to take them down, because regardless of what's going on in your life, whether it's a new job or a crappy marriage, it should not affect your organs. You cannot allow that. That means you're not protecting yourself. You have to stand up for yourself. You have to breathe no matter what.
So what would you say to, because you know this as women, we tend to, it's seductive to put ourselves on the back burner because I have to care for this person. I have to care for this person. Especially, I can think of some women that I have in my classes who are caretakers, and they have really demanding roles as caretakers. So it becomes so easy. And you're talking about, I think that's the last thing that would be on your mind. I've got to get to the bathroom so I can go back and I can help my husband up, or I can, relieve the nurse is coming, or, So what would you say to this person about slowing down for something that seems inconsequential in the grand scheme of things?
The first thing I would say is it's not inconsequential. It's very consequential. And it's not just consequential to you. It's consequential to the people you're taking care of. Because if you cannot put yourself first to regulate your own body systems, make sure that you're getting enough to eat, enough to sleep. And listen, I'm not saying this is easy. If you think I'm saying this is easy, I am not saying that. This is hard. Okay. But you cannot take care of another person in this world if you do not put yourself first. You always have to put yourself first. And I don't mean go to the movies when someone really needs you. Obviously, that's not what I'm talking about. But you have to give your body air. Think about it. Can you function if you weren't breathing? If you're not breathing, do you think you can make good decisions, that your judgment is working well without oxygen?
You know what? I have a little idea, and I may be wrong, but I really think we would have so much less road rage if people could just breathe.
People need to learn to breathe. We have not been taught. We do not know how to do it, because breathing always starts with a sniff, and nobody's told us that. Breathing is supposed to be with the lower half of our body, not the upper half. So when you understand that nobody's doing that, you understand that none of us have learned to regulate our nervous systems. And that's why we have road rage, because you will not see the objective reality if you're suffocating. Mm-hmm. You will not know that this is just a stupid thing, and it will make no sense for me to go after this person in road rage. It just makes no sense to my life. I got a job. I got a family. Why would I waste my time and possibly put myself in danger for a minute of it, for a trigger? No, that's not what an adult does. That's what a child does. So if you want to grow up, you breathe, and you don't allow yourselves to engage in dysfunctional behaviors. I mean, listen, I'm reading everybody the riot act on this, but I just see this in all people, and I see it in myself. See, I couldn't talk to people like this if I wasn't talking to myself like this, to say, hey, you got to breathe. I do this all day long. People are always like, I don't see you breathing, Dr. Fleischmann. I don't see you breathing. I'm like, you're right, because you're making me crazy right now. So I'm not breathing. But when I leave the room, I am going to be pulling the air from my nose to my body to just sort of cleanse myself of whatever happened there. And listen, most of my patient interactions are lovely. My patients are so grateful. But yeah, every once in a while, I get dysregulated. I'm not breathing. And I have to center myself. I have to leave the room to do it. And I do that for my other patients. Because if I walk into the next room agitated, I'm not going to be there for that woman. So it's just a way to do for yourself so that you can really do for others. And that's why I think teachers and nurses, and these are my biggest clientele. They are all neglecting themselves to take care of other people. And a lot of them have families. And I just say, listen, you can't do it. You have to be paying attention to this is your job. Your job first it's the ABCs. Your job to yourself is airway, breathing, and circulation. You cannot skip that job. Okay. So you have to use your airway, which happens to be your nose, everybody. The nose is the airway. It's not the mouth. The mouth is for eating. The mouth is the emergency airway. When you're really in a panic, you can use your mouth, but it should always be through your nose, exhaling and inhaling through your nose. That's airway. Breathing is how the air enters your body. What are you doing? It should be starting with a sniff and releasing your abdomen and glutes. That's how you pull the air. It should feel like a vacuum going to the other side of your body. When you do that, you're creating circulation throughout your whole body. After that, go take care of somebody else, but not before.
All right. I mean, okay.
It's hard. This is a practice. It's like bringing yoga into your life. It's basically living in yoga. And it's not easy to do, but I think it's the next stage of consciousness. To me, this is what growing up is.
And you never arrive. It's never, I'm at this point now where everything is under control. We live with our changing bodies. We live with our changing circumstances because these things are inevitable. But what we can do is adapt. And so adapt to the situation by always coming back to what can I do right now? And breathe. A breath is
But you have to know how to take it. And that's the thing. I was shocked to learn that everybody didn't know how to breathe. I was shocked to hear that. You can't just say, go breathe.
I see that in yoga classes often.
Yes. And we need to be aware of that as a community, as a collective. We need to understand that no one's been taught to breathe because we never learned the sniff was the start of the breath. We never learned that. I had to learn it through science. I had to learn it through research. I had to learn it through paying close attention to what were we missing. And I realized it was this.
Okay. 2 more questions. For someone who really needs help, what are some resources? And I ask this because there were a couple of situations in your book, Real Patients, who came to you after a very frustrating road of not being able to find answers. So to a person who feels like, I can't seem to get this taken care of, this is persistent, it keeps coming back, how can they get help?
So we're talking about pelvic floor problems like incontinence or UTIs or whatever it is, pelvic pain. That's another one. Go see a doctor. I always tell people to go to the doctor. I would never tell anybody to just breathe and not go to a doctor.
Right.
So that's number one. And you should research your doctor and just make sure that, they know that they're specialized in this field. I will tell you that I have not met a single person who doesn't need a pelvic floor therapist in most cases. I mean, pelvic floor therapists, and there's not that many in the country. Maybe there's 2,000. There's not enough for them to see every woman. It's just not going to happen. But you can try to get in there. Not every pelvic floor therapist understands this stuff, but a lot do. And I think, that, you're more likely to get some help from that person than from a doctor, but you should go to a doctor because if there's something actually wrong, you want to know that. And what do I mean actually wrong?
Structurally wrong.
Structurally wrong. So what could that be? Well, you could have, a dropping bladder that does need to be surgically corrected, but I don't correct those until I teach you how to breathe first. So realize that, kidney stones, whatever it is going on in your body, God forbid a cancer. Yes, you want to know that. So you don't skip BMD. I still believe in going to the doctor, but I do think in most cases, if not all cases, pelvic floor dysfunction is the cause. It's the root cause of everything. So you do need to learn to get that under control. And my book you can get my book, see if you can. I've had people figure it out from reading the book. I've had people who haven't been able to figure it out, but I think we just have to all do what we can. It's going to be hard to turn ourselves around to understand this stuff, but I do have hope. I really do. So just go to the doctor first, and a pelvic floor therapist would be a great addition to life.
Okay.
Or YouTube. You can YouTube a lot of this stuff now. I think that you can really learn a lot of these exercises on YouTube. I don't tell my patients to do exercises, but there's ways you can find to connect.
What is your personal definition of what it means to be healthy?
Well, you know what I'm going to say, Nadine. I think it's pretty clear from this conversation. I'll tell you. I'll try to make it simple, okay? Because it's very hard to explain this, but you have to understand, in order to be healthy, that you were born with an internal biofeedback system that you do not know is there, okay? It's in all of us, and it has to be activated by someone just telling you that it's there, okay? So if you take a sniff, and that's just a quick pulse through your nose, you will feel your bottom move. That is the start of the internal biofeedback system. Is a call to the bottom of your body. And that pressure that goes to the bottom, and you can put it towards the front wall, to the abdomen, to the back wall, you can direct it. It teaches you how your body looks. You get an image in your brain. My vagina is clenched, it's open, my abdomen's in or out. We need to develop sensory motor awareness of the lower half of our body, which can only be done through the sniff, in order to be healthy, because that's how to breathe.
Dr. Nicole Fleischmann, it has been such a pleasure. I am
so great.
Happy to have had this conversation. And I just know this is going to impact several people. I'm going to keep spreading the message. So thank you.
Disciple. I love it. And I will keep listening to your podcast because I've learned so much already. I really love what you do, and I'm impressed, and I appreciate your dedication towards these issues, because we need platforms to get these things out. I'm looking for platforms, and I thank you for opening your mind to me.
Thank you. Wise women, move from last place to first place in your life. Stop using your body as a battlefield. Let's raise health together with a customized health plan just for you. Contact me at npkhealthintegration.com. Thanks for listening. See you next time.